Okay, and folks, please remember to mute your lines. Thank you. Okay, so I will be recording. Marcy's going to kick it off and give us some background, and then she's going to turn it over to some of our service coordination managers. Marcus and Jennifer will be speaking about the core elements and the supplemental within the CPU. So Marcy, are you able to get off mute?
I am, I'm here.
Awesome. Okay, so periodically we'll stop and see if there's any questions within the chat. Once again, we are recording. We will be posting this on PHW University. Last week's should be posted within the next 24 hours. And also, if you have not received the slide deck from last week's Element 1 CAU, please either ask your supervisor or manager, and they can share that with you. Okay, I'm going to turn it over to you, Marcy.
Okay, thank you, Olivia. I've also asked Shirley Stoller from the quality team to monitor the chat box. What we're going to do is collect all the questions and answers and then put those in an FAQ for the end of the training sessions. We'll send those out. So if you miss the answer, don't worry, we'll get it to you. Okay, with that said, okay, with that said, we'll move to the next slide, please. Okay, so today we're going to talk about the LTSS Comprehensive Care Plan and Update Element measure, also known as LTSS-CPU. Next slide, please. Okay, so with each measure, as you remember from the last session, there are core and supplemental elements that make up the measure. So the core elements for this measure are participants who had a comprehensive LTSS care plan with 9 core elements documented within 5 days of enrollment for new participants or during the measurement year for the established participants. You'll probably notice that we moved the slides to be consistent with the turnaround time that you all have for this measure, which is 5 days. The HEDIS measure has 120 days, so it's a huge, large number of days to take off your lead time. So just be sure that you keep that in your mind. So the 9 core elements are here on the slide. I won't list them all out. You all can read it, and we will be going through each of those one by one. Okay. Next slide, please. Okay, you'll see this slide for every core and supplemental section that we do. Key concepts, again, they're very similar to the ones in CAU. So all 9 core elements must be documented to meet compliance. So there are 9 core elements. You have to have all of them documented. We do have exclusions that are allowed, again, the following cases. If you can't reach them for care planning, you must document 3 attempts, and that must include the contact you made, the date, and the mode of the contact, and that the participant couldn't be reached. You can also document an exclusion for participants who refuse to participate in care planning. And finally, the red bullet, NA is not an acceptable response for any question. Okay, we can move to the next slide. Okay, I'm going to toss it over to Marcus to walk you through each of the core elements.
Yeah, thanks, Marcy. All right, can you hear me?
Yep.
Okay, awesome. All right, so we'll go ahead and start off with core element 1 for CPU, and that's to document at least 1 individualized participant goal. That can be medical or non-medical with the outcome that's important to the participant. So you'll see here some of the examples like losing weight, reducing specific symptoms, staying out of the hospital, in addition to some of the other listed potential examples. You can document that the participant is too cognitively impaired to provide a goal and has no family, and that would meet the element. So yeah, please note that the goals are going to be determined solely by the provider without participant input or automatically generated based on patient conditions or risk factors. So those do not count as participant goals. Go to the next slide. So these are the areas identified where we would document those individualized goals. You'll see here in this first portion under nurse or facility and HCBS, that means that it's applicable to both, and you would document those in the same area. on the PCSP. So the measure is going to be looking for a personal goal that the member is working towards. So think about things like hobbies, health, nutrition, etc. So you'll see it on PCSP on page 17 through 19 and or PCSP page 2, where it says, tell me about your daily routines, or in the goal, needs, barriers, interventions section on the PCSP. In addition to that, specific to HCBS on the NRI, on question 10 in section 8, where it asks for the person's expressed goals of care. All right, we can go to the next one. All right, so CPU core element 2 is going to be a plan of care to meet the participant's medical needs. So an example of that is basically support for managing or treating chronic or acute conditions. So you're going to document that the plan addresses the participant's needs, or that the participant does not have medical needs. Go to the next one. Here, you'll see there are areas on the PCSP for you to document those things. First one is on page 12. It'll ask you, do you receive any home health services? What other home health services do you receive? And what assistive devices are you using? And then even more, so we'll have on page 28 through 29, how often do you take your medications as prescribed? If you rarely take them as prescribed, explain why, so on and so forth. And then on page 14, it'll ask you about a behavioral program or plan. And if you're on one, you'll be able to provide additional information in that field for the free text. All right, we can go to the next one. And continue, you'll see page 17 through 19. You'll have the person-centered care plan and outcome section, which again is the goals, needs, barriers, interventions. So those are typically connected to the services, which means that the goals can be medical if the services are going to help them overcome or address some sort of medical condition. And then on page 27, it'll ask you if you had all of your needs addressed in this plan of care, and to please explain if you did. Over here to the right, this is actually the portion of the HRA. This will look familiar because this is also on the PCSP. But it'll ask you, have you ever been told by a healthcare provider that you have any of these conditions? So you'll be able to check all that apply. Then you can go to the next one. And then, of course, specific again to those folks in the community, section I, disease diagnoses on the NRI, and section J, health conditions on the NRI will meet that element as well. All right, you can go to the next one. All right, so for core element 3 for CPU, a plan of care to meet the participant's functional needs. So an example of that is support that they receive for ADLs or IADLs. And again, you'll document that the plan addresses the participant's needs, or that the participant does not have any of those functional needs. Next slide. All right. So under nursing facility and HCBS, you'll both document it. Here on the PCSP on pages 11 and 12 under the pain and ADL section, there will be several questions specific to some of the activities of daily living and whether the participant can actually perform those activities of daily living. The same can be said over here to the right. This is a screenshot of the health risk assessment. This is, of course, is going to look slightly different in the portal versus TrueCare, but the content is the same. So under the activities of daily living section, and some of this from the member information section will meet this element. Next slide. Then you'll see more here on the PCSP. Again, you can document some of that under the person-centered care plan and outcomes, where you list your goals. And then also on PCSP pages 17 through 22, which is the service plan section, you'll be able to document some of that here too, and it'll meet the needs of the element. Next slide. So for HCBS folks on the NRI, under section G, functional status, which is something I'm sure every external service coordinator on a call is very familiar with, you'll be able to capture the ADL self-performance, IADL self-performance, as well as the capacity for those IADLs. And that'll contribute to meeting the need of the element as well. Next slide. So element 4, It's going to be a plan of care to meet the participant's needs due to cognitive impairment. Some examples will be support for behavioral difficulties, caregiver support, or education to address those cognitive impairments, as well as support for engaging the participant in different types of activities. Again, you're going to document that the plan addresses the needs or that the participant does not have needs resulting from any kind of cognitive impairments. Next slide. Here for nursing facility and HCBS on the PCSP, you'll see page 7. Are you having problems with any of the following? You'll see that cognitive issues is one of the options. If cognitive issues is checked, you'll be able to give details here in this free text section that tells you to discuss barriers to any of the above. Again, also on page 14 of the PCSP, it'll ask about a behavioral program or plan. So if the participant is utilizing a behavioral program, then you'll be able to give details in the corresponding questions below that. Next slide. And then on the interact, under section C for cognition, there will be multiple questions that meet the need of the element. So you'll be able to go to cognitive skills for daily decision-making, memory/recall ability, periodic disorder thinking or awareness. So essentially that entire section contributes to meeting the need for that for element 4. Next slide. All right, so element 5 is a list of all LTSS services and supports the participants receives or is expected to receive in the next month in the home. Those can be paid or unpaid or in other settings, i.e. it can be an adult daycare center, a nursing facility, residential habilitation, just different settings that the person may live in. So you'll be including the amount, the frequency, and then if they do not have any LTSS needs, then you'll just simply list that they do not receive any LTSS. All right, next slide. So on the PCSP, again, you'll see the person-centered care plan and outcome section. That's always going to be connected to the service plan, as the goals are required to be connected to the specific services that the participants are receiving. So those typically go hand in hand. Next slide. And then for HCBS and the interact, if you look at section N, which is treatments and procedures, you'll be able to fill out areas of this. A lot of it is going to be related to question number 3, which is formal care. It'll allow you to list the minutes and the days that the person's receiving different types of formal care. So that can be home health, which in this case would be PASS, a home nurse, which would actually be home health, homemaking services, meals, physical therapy, OT, etc. Go to the next slide. So then it'll ask you, we'll look at element 6, which is a plan for care manager to follow up and communicate with the participant. And so it can be a follow-up and communication schedule with the person, essentially. So if you look on the PCSP on page 4, one of the questions is how frequently will the service coordinator communicate with the participant or the designated representative? Depending on what the need is, you'll list it there, whether it's monthly. For HCBS, it'll be at least monthly, but it could be more often as needed. And then it'll ask you on page 19, is follow-up required and what the time frame to reassess any barriers for goal progression and follow-up are. Next slide. So element 7 is a plan to ensure that participants' needs are met in an emergency. At a minimum, make sure you include the name of the LTSS organization, staff, or the contract provider to contact in an emergency. Next slide. All right, so here you'll see something that I'm sure everybody is also very familiar with, the backup and emergency plans. There you should be able to detail all the information that you need related to backup plans, whether that's going to be through an agency or whether that's going to be informal backup plans through family members, friends, or some other source. So that'll be on pages 23 through 25 on the PCSP. Next slide. Again, you'll be able to look at the person-centered care plan and outcomes, and then you'll be able to look at the service plan section. because the service plan section is the area where you're going to list those formal supports, i.e. the agencies that are providing the services via LTSS or any of those other services they might be receiving through another source. All right, next slide. So core element 8 is going to be family and friends, or caregivers who were involved in the development of the care plan and their contact info. So documenting either that there is no family/friend caregiver involvement or that family/friend caregivers were invited to participate in the care planning but declined will also meet the element. Next slide. All right, so on PCSP page 4, you'll see some of the questions under the person-centered team section. I ask you whether any of your chosen person-centered team have a possible conflict of interest. Did you choose the time and date and location for the day's meeting? May you have permission to contact the other members of the person-centered planning team. So a combination of those questions will meet the needs of the element. Next slide. And then the last core element would be the participant or participant rep agreement to appeal or the completed plan of care. So the documentation is going to include the participant/representative verbal agreement by telephone or in person, or written agreement, which can be a signature sent by mail to the case manager. Documenting that plan of care was discussed or reviewed does not meet the measure. Agreement or appeal by the participant and rep must be documented. So next slide. So you'll see here on PCSP page 27, under the acknowledgements, it'll ask, do you have any unanswered questions, or would you like additional information? You'll be able to explain if so, and have all of your needs and or risks been addressed in the plan. You'll be able to explain in the free text section. Also under acknowledgements, you'll see the member and the authorized representative are able to sign. And then actually on the newer version of the PCSP, it gives you 2 lines where you can sign. One, you can sign because you agree to what is listed on the PCSP. The other one, you can sign, the participant and a representative can sign because they did not agree with what's on the PCSP. So those 2 things assist in meeting the needs of that particular element. All right, next one. So I'm going to go ahead and turn it back over to Marcy briefly to go over some additional information.
Thanks, Marcus. Olivia, do you want to take some time now to address some of the questions that have come in before we get too far down the course?
Sure. Okay. If we are getting a verbal agreement, how do we document that under the signature section? Any of the managers on the call can feel free to chime in.
Personally, for HCBS, I would just put in unable to sign right there, since they're not able to sign in person. And you'll be able to document it in another area of documentation, whether that's the member contact assessment or some sort of other note that you might be putting in the system. And
you can put unable to sign due to COVID or due to telephonic assessment as a result of COVID. Any of the internal managers on the line, would you like to address it for, I'm not sure if you've directed your, our nursing facility SCs the same.
Yeah, I would say it's the same for a nursing facility. I don't think we would do anything different than what Marcus just suggested.
Okay, great.
I think one of the things, just documenting they're unable to sign, but also making sure that you put that they agree to it, because that's a critical piece of the whole element.
Okay, I have your example indicated if a participant is too cognitively impaired to express a goal and has no family. What if they do have family and or an authorized rep? Well, then you should use that person-centered team to help set that goal. This next one's about our new assessments. And I'm not sure if we can answer this right now or not, but for the logic that has now been built into the PCSP, when an answer is no, can the subsequent fields that do not need to be filled in be grayed out? As a reviewer, it's difficult to determine
To
if a blank
determine
space.
if a blank space is part of the logic or missed by the worker, it got split up.
Okay. Well, I mean, right now, the logic is what it is. We can always take that as a suggestion and take that back to our design team. So thanks for that suggestion. We'll make note of that.
Got it.
Okay. It's all yours, Marcy.
Thank you. Okay, so now that we've gotten an overview of the core elements, we'll move to the supplemental elements. Next slide. Okay, you probably remember from the last time when we talked about supplemental elements that in order to get full credit for supplemental elements, you have to document all 9 of the core elements as well. So the supplemental score is a combination of the core and supplemental. So for this one, you need 9 of 9 core elements and 4 of the 8 supplemental elements that are available to you. And again, they have to be documented within 5 days of enrollment for new participants or during the measurement year for the established participants. Okay, next slide, please. Okay, broken record here. To be fully compliant, we need 9 of 9 core elements in addition to 4 of 8 supplemental elements. Okay, exclusions, we have the same exclusions as we did for the core elements. Could not be reached for care planning. Make sure that you document the 3 attempts. Also excluding if they refuse to participate in care planning. And the big red dot, NA is not acceptable as a response for any question. Okay. Next. Okay. Supplemental elements. So here we are, we have 8 supplemental elements. So what we're going to do is go through each of those supplemental elements, and also keeping in the back of your mind that all 9 core elements have to have been completed as well to document full compliance. So I'm going to turn this over to Jennifer Ford Bay, who will take it from here.
All right, good afternoon. Next slide. Okay, so for the CPU supplemental element 1, this is where we're looking at the plan of care to meet the participant's mental health needs, documenting either the plan that addresses their needs or that you're documenting that they do not have any mental health needs. Next slide, please. Okay, so we're going to primarily document this on the PCSP page 14. This is the page that specifically asks, are you on a behavioral health program, additional information to provide, so on and so forth. It's really important that, again, broken record, it's going to be really important that we don't put NA here, that you do write out that they do not have any mental health needs at this time. Next slide. For our HCBS members, we would also document this in the inter-RAI, specifically in section E and I. Those are the ones that talk about mood and behavior and also any disease diagnosis going on as far as neurological. Next slide, please. Okay, so for CPU supplemental element 2, this is where we're talking about the plan of care to meet the participant's social or community integration needs. So a good example of this is social activities with friends and family, participation in community-based activities, participation in work or volunteer activities, and then documenting that the participant does not have social or community integration needs does meet the numerator criteria. Okay, so for nursing facility and HCBS participants, we would document this in the PCSP pages 7 through 10, where we talk about community integration. It asks you about volunteering, it asks you about interest in working, it asks you about all the things that might be a barrier to them getting to those activities and how we are mitigating those. So that captures it perfectly. We're also looking at the HRA under social concerns. that's going to really meet the element as well. For supplemental element number 3, the duration and how long the services will be provided for, or when need for services will be assessed of all the LTSS participant receives or is expected to receive in the next month in the home, paid or unpaid, or in other settings, including adult day, nursing facility, or the date that when services will be reassessed. Documenting that the participant does not receive LTSS meets the numerator criteria. So this is really going to be documented in the PCSP service plan on pages 20 to 22. I know in the new PCSP, it does look slightly, actually, no, not here, but this is where we're going to be really listing out all that the members receiving when we're going to be reassessing them again for those services. So it kind of hits everything all in one shot, right in the service plan. Next slide, please. For CPU supplemental element 4, that's the contact information for the participant's LTSS providers. Again, documenting that the participant does not receive LTSS meets the numerator criteria. Next slide. So again, PCSP service plan, this also is going to detail out who's providing the PERS unit, who's providing the pass for that participant, what's the agency's name, and information should be in there under the provider. Next slide, please. Okay. So this is for supplemental element 5, we're talking about the plan to assess the participant's progress towards meeting established goals, including timeframes for reassessment and follow-up. And here we're going to be looking at the PCSP, pages 17 through 19. That's where we're addressing the goals, needs, barriers. I'm going to apologize in advance. I live really close to train tracks, and there's one coming through, so sorry if you hear anything. Also on page 4 of the PCSP, it talks about how frequently the service coordinator will communicate with the participant and how often they'll be reassessing those needs. Next slide. CPU supplemental element 6. This is the barriers to meeting defined goals. Examples include life, community, or health factors that may make it difficult for the participant to meet those goals that they are setting for themselves. And again, right in the person-centered service plan, pages 17 through 19, and actually, I like the way the new PCSP lists it out, so you can see the barriers right there. Okay, supplemental element 7 talks about the participant's first point of contact. Providing the care manager's contact information to the participant meets the element here as well. We can document this very well on the PCSP page 3. This is where we ask who do they want to be a part of their person-centered team, as far as family, as far as people from the community, friends, providers. This should be all-encompassing for anyone who they would want to be involved in those decision-making meetings with the person-centered team. Okay. So element is contact information for the participant's PCSP. So it's important that we put down the contact information for the participant's primary care practitioner or a plan for connecting the participant to a PCP if the participant does not currently have one. So in the PCSP page 11, it does say, what is your doctor or health provider's name? Well, that's a perfect place to put it. And then it would really be important if they say that they do not have one at that time, that there's that you are planning on connecting them to a PCSP in the community and helping them through that process.
Great. We got through our slides very quick. Okay, so this gives us an opportunity to get through all of the questions within the chat. Okay, so managers on the call, please feel free to chime in. Okay, are mental health medications considered a mental behavioral health plan? I would say no. It's part of the behavioral health plan, but that wouldn't be it wouldn't meet the element by just listing the mental health medications.
Mm-hmm.
On the PCSP, that whole section of behavioral health would have to be filled out in my eyes. Okay, I have a question about SMART goals, or goals listed at the top of the NRI in the box. It states goals. Example, I have a client that is constantly in and out of the hospital. The reason for the recent hospitalization are all due to not being consistent with dialysis 3 times a week. So would her goal be stated as, this participant is to be consistent with dialysis weekly to decrease hospital admissions? Okay, a couple ways to look at this here. So when you're filling out the NRI, you always have to fill out the PCSP. There are 2 assessments that go hand in hand. We know that the NRI's box, I'm not sure if there is a character limit in that box for the goal on page 1, but the elements for a SMART goal would be, SMART. So we would have to be specific, measurable, relevant, timely, and
Attainable.
Attainable, sorry. Drawing a blank. So basically we have to click all of those elements for her goal. So I see that this is relevant to her, okay, because you're saying that her biggest barrier is these being consistent with dialysis. 3 times a week would be measurable. Let's see, specific. You're being specific here because you want to reduce hospitalizations. Relevant, okay, it's relevant to her. Attainable. And timely. I want to say that we have to expand on the timely in this goal.
Yeah, it needs it kind of needs an end. So Ms. Kate's goal is to be consistent with dialysis weekly to decrease hospitalization for 6 months or for a year, something like that.
Mm-hmm.
Did you say that, Olivia?
I would say that. I agree with that, Arzelia.
I would also go further to challenge you to see, why is she missing dialysis? Is it transportation issues? Is it she doesn't have motivation to get up in the morning because of something else going on? So I would also think about, why is she missing the dialysis sit times, and what can we do to decrease that?
I agree. So that can be expanded upon within the PCSP barriers section. Okay, page 4 on the PCSP doesn't give you an option for annual visits in the drop-down. Okay, we'll make note of that. Marcus, can you look into that one?
Yep, sure can.
Awesome.
Are you, but before we move on to the next one, I'm assuming you're talking about how frequently will the service coordinator communicate with a participant or designated representative?
Yeah, I'm assuming.
For the time being, just please click as needed in the drop down.
What's the question again specifically, Marcus?
Unless I'm incorrect, it is how frequently will the service coordinator communicate with participant or designated representative? For all HCBS people, it's required to do it monthly, so I'm not sure why that would be different for anyone.
Yeah, annual shouldn't even be an option for that because it should be monthly outreach. Okay. So if they're, okay, this is in regards to the behavioral health. So if they are only taking a medication, then they are not on any type of plan. Well, if they're taking a medication, I believe that is considered a behavioral health plan. So if I'm taking medication for anxiety, for example, then, that would be a plan with my prescribing physician, whether it's, a psychiatrist, whether it's my PCP, whoever is prescribing that medicine. The plan would be to take this medicine to reduce my anxiety.
Right. So just because there's not a specific plan in their chart, if they're on a behavioral health medication, it is part of a behavioral health plan. Right? Kind of makes sense.
Mm-hmm. I'm sorry, I'm reading through here to see which ones we did not cover.
Yeah, I'm trying to capture.
It's a lot of good interaction today.
Mm-hmm.
Oh, there's a storm behind me, y'all. There's a question about the inter-RAI. For those elements that you're using the inter-RAI, how is the plan of care being captured there?
Yeah, we'll talk to Lori offline about that one. I think we just have to dig in a little bit more. The NRI, when it's capturing, it's not the sole place that it's capturing the plan of care. Okay. I think we might have covered everything in regards, the majority seems like it's behavioral health questions and about the plan. It's not necessarily so, you're not going to get a piece of paper that says this person's on a behavioral health plan. But if they do have an active diagnosis, a behavioral health diagnosis, anxiety, depression, bipolar, whatever the case may be, any of those behavioral health diagnoses, generally they are on some sort of treatment. And if they are, receiving treatment such as medication or counseling or therapy, that would be considered a behavioral health plan. Yeah, so any behavioral health med is part of a behavioral health plan. That would be the plan of care. So if my doctor prescribes me a medicine for anxiety and says, you need to take this twice a day, and visit with me 3 months from now and we'll see how you're doing, that would be my behavioral health plan. It doesn't have to be something written on a piece of paper or anything that states, hey, this is my behavioral health plan. If they're being treated for a behavioral health diagnosis, then that would be their behavioral health plan. That's also with, counseling or any kind of, mental health therapy. They may not be on any medications, but if they are seeking therapy or if they're in treatment or therapy for some sort of diagnosis that they have, that would also be part of their behavioral health plan. I'm not sure I understand. So if they're taking something and there is no follow-up to access meds.
Could you clarify that one?
Okay, it's correct. If their doctor didn't give them a set time to follow up. Well, generally, I know there's rules with prescriptions, and if they are on, any kind of medicine, the rule would be to follow up with whoever that prescribing physician is yearly. It can't be prescribed if they go beyond a year. I know, for me, I'm on a medicine, and I know I saw my PCP last August, so that means I'm going to have to see my PCP again to get that one medicine refilled at my pharmacy. If I don't follow up with them within a year, they can refill it temporarily, but that's pretty much it. I'm going to have to make an appointment to get that med continued for another year. Okay, great.
So Olivia, this is Marcy. So if there isn't anything specified in this case, would the default be follow up with PCP or the prescriber within 1 year?
Mm-hmm. And that's for any med, not just behavioral health. So that would be, blood pressure medicine, whatever the case may be, same story.
Okay, I just wanted to
Yep.
give them a backup so that they had something if there was nothing listed. So the
Yeah,
fallback
absolutely.
plan. Okay, perfect. Thank you.
Sure. Okay. Okay, so I'm going to leave the chat open for a little bit, at least another maybe 10 minutes. But I just want to thank everyone for joining today. Next week, same place, same time, we're going to cover our last element, which would be RAC, and then also a little bit on making that service plan, the person-centered service plan, available to the PCP. That's also part of our HEDIS requirements. So thanks for joining. I hope everyone has a dry rest of their Tuesday. I know Pittsburgh is soaking wet here, so enjoy the rest of your week, and we will talk soon.
Thank you.
Everyone.